Question 1. Governance review demonstrates a critical care registered nurse receives a physician's order that, based on the nurse's clinical judgment and understanding of current best practices, appears to be potentially unsafe for the patient. The nurse has attempted to clarify the order with the physician, but the physician insists it be carried out as written. What is the most appropriate immediate course of action for the registered nurse? Option A. Carry out the physician's order as written to avoid insubordination and potential disciplinary action. Option B. Immediately contact the state's Board of Nursing to file a formal complaint against the physician. Option C. Document the physician's order and the nurse's concerns in the patient's chart and take no further immediate action. Option D. Escalate the concern to the charge nurse or nursing supervisor to discuss the order and seek guidance on how to proceed. Ensuring patient safety is paramount. Correct answer is D. Escalate the concern to the charge nurse or nursing supervisor to discuss the order and seek guidance on how to proceed. Ensuring patient safety is paramount. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a conflict between a physician's directive and a registered nurse's ethical and professional judgment regarding patient safety and regulatory compliance. The nurse is faced with a situation where a physician's order, if followed without question, could potentially lead to patient harm and violate established critical care protocols and potentially regulatory guidelines for patient care. The challenge lies in navigating this hierarchical relationship while upholding the nurse's primary responsibility to the patient and adhering to professional standards. Correct approach analysis. The correct approach involves the registered nurse advocating for the patient by questioning the physician's order and seeking clarification. This aligns with the core ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Professionally, critical care nurses are expected to exercise independent judgment, critically assess orders, and escalate concerns when patient safety is compromised. This approach respects the physician's role while prioritizing patient well-being and adhering to the nurse's scope of practice and professional accountability, which includes reporting potential violations of care standards. This is further supported by professional nursing standards and organizational policies that mandate nurses to question orders that appear unsafe or inappropriate. Incorrect approach is analysis. One incorrect approach involves blindly following the physician's order without questioning. This represents a failure to exercise professional judgment and a potential violation of the nurse's duty of care. It could lead to patient harm and expose the nurse to professional liability. Ethically, it prioritizes obedience over patient safety and professional responsibility. Regulatory frameworks for nursing emphasize the nurse's role in patient advocacy and the responsibility to ensure care is safe and appropriate. Another incorrect approach is to immediately report the physician to a regulatory body, without first attempting to resolve the issue directly with the physician or through established hospital channels. While reporting is a necessary step if concerns are not addressed, bypassing direct communication and escalation pathways can be seen as unprofessional and may not be the most efficient or effective way to ensure immediate patient safety. It can also damage professional relationships unnecessarily. A third incorrect approach is to ignore the order and take no action. This is a clear dereliction of duty. The nurse has a professional and ethical obligation to respond to physician orders, especially those that raise concerns. Inaction in the face of a potentially unsafe order is a direct violation of the nurse's responsibility to the patient and could have severe consequences. Professional reasoning. Professionals should employ a structured decision-making process when faced with such dilemmas. This typically involves 1. Recognizing the ethical or professional issue. 2. Gathering relevant information, patient condition, order details, relevant policies/protocols. 3. Identifying the ethical principles and professional standards at play. 4. Exploring alternative courses of action. 5. Evaluating the consequences of each action. 6. Choosing the best course of action based on ethical and professional obligations. 7. Implementing the chosen action and evaluating its effectiveness. In this case, the process would lead to seeking clarification from the physician and, if unresolved, escalating the concern through appropriate hospital channels, potentially involving a charge nurse, supervisor, or ethics committee, before considering external reporting. Question 2. The performance metrics show a slight increase in coding discrepancies related to critical care diagnosis, as a critical care registered nurse involved in ensuring the completeness of patient records, which understanding of the ICD-10-CM structure is most crucial for contributing to accurate coding. Option A. Relying primarily on the alphabetical index to quickly locate potential codes for common critical care diagnoses. Option B. Recognizing that ICD-10-CM is organized into chapters by body system or condition, with a hierarchical structure that requires coding to the highest level of specificity as documented. Option C. Prioritizing the assignment of codes for the most severe or life-threatening conditions, even if less severe conditions are more thoroughly documented. Option D. Assuming that all codes within a specific chapter of ICD-10-CM are interchangeable and can be used based on general clinical impression. The correct answer is B. Recognizing that ICD-10-CM is organized into chapters by body system or condition, with a hierarchical structure that requires coding to the highest level of specificity as documented. Explanation. Scenario analysis. This scenario is professionally challenging because accurate ICD-10-CM coding directly impacts patient care documentation, reimbursement, and public health data. Misinterpreting the structure and format of ICD-10-CM can lead to incorrect code assignment, which has downstream consequences for all stakeholders. Critical care nurses, while not typically primary coders, are often involved in ensuring the completeness and accuracy of the medical record, which forms the basis for coding. Understanding the fundamental principles of ICD-10-CM structure is crucial for effective communication with coding professionals and for advocating for accurate documentation. Correct approach analysis. The correct approach involves recognizing that ICD-10-CM is organized into chapters based on body systems or conditions, with specific guidelines for sequencing and specificity. This hierarchical structure, from broad categories to highly specific codes, is essential for capturing the precise nature of a patient's condition. Adhering to these structural principles ensures that codes accurately reflect the documented diagnosis, facilitating appropriate reimbursement and reliable statistical analysis. This aligns with the ethical obligation to maintain accurate patient records and the regulatory requirement for precise medical coding. Incorrect approaches analysis, an approach that focuses solely on the alphabetical index without considering the tabular list, and its associated guidelines demonstrates a fundamental misunderstanding of ICD-10-CM structure. The index is a guide, but the tabular list contains the definitive codes and important instructional notes. Relying only on the index can lead to selecting inappropriate codes. This represents a failure to adhere to established coding standards and could result in inaccurate data. An approach that prioritizes common diagnoses over specific documented conditions ignores the core principle of ICD-10-CM, which is to code to the highest level of specificity. This can lead to undercoding or misrepresenting the patient's true clinical picture, impacting both reimbursement and research. This is a regulatory failure as it violates the mandate for accurate and specific coding. An approach that assumes all codes within a chapter are interchangeable or that the order of codes is arbitrary disregards the hierarchical nature and sequencing rules of ICD-10-CM. Specificity and sequencing are critical for reflecting the primary reason for the encounter and any coexisting conditions, which is a fundamental aspect of the coding system's design and regulatory intent. This leads to inaccurate data and potential compliance issues. Professional reasoning. Professionals should approach ICD-10-CM structure by first understanding its chapter-based organization. They should then learn to navigate between the alphabetical index and the tabular list, always referencing the tabular list for the definitive code and associated guidelines. Emphasis should be placed on coding to the highest level of specificity documented in the patient's record and understanding the rules for sequencing codes. This systematic approach ensures accuracy, compliance, and effective communication within the healthcare team. Question 3. The assessment process reveals a critical care patient with diminished breath sounds noted in the lower posterior aspect of the right chest. The nurse needs to document and communicate this finding to the respiratory therapist for potential intervention. Which anatomical terminology is most precise for describing this location? Option A. Right posterior chest wall, inferior aspect. Option B. Right lower lobe, posterior segment. Option C. Right lung base back. Option D. Right side bottom back. The correct answer is B. Right lower lobe, posterior segment. Explanation. The assessment process reveals a critical care patient experiencing acute respiratory distress. Accurate and precise anatomical terminology is paramount in this situation to ensure effective communication among the healthcare team, leading to timely and appropriate interventions. Misinterpretation of anatomical locations can result in delayed or incorrect treatment, potentially exacerbating the patient's condition and leading to adverse outcomes. The challenge lies in the need for immediate, unambiguous communication in a high-stakes environment. The correct approach involves using precise anatomical terms that clearly identify the affected structures and their relationships. This ensures that all members of the care team understand the exact location of findings, such as a specific lobe of the lung, a particular intercostal space, or the position of a medical device. This adherence to standardized, accurate terminology aligns with professional nursing standards and ethical obligations to provide safe and effective patient care. It facilitates clear documentation, accurate reporting to other disciplines, and ultimately optimal patient management. An incorrect approach would be to use vague or colloquial terms. For example, referring to the bottom of the lung instead of the left lower lobe or right lower lobe can lead to confusion. This lack of specificity can result in miscommunication regarding the location of auscultated breath sounds, the insertion site of a chest tube, or the extent of a pulmonary infiltrate seen on imaging. Such imprecision violates the professional standard of clear and accurate communication, potentially leading to errors in diagnosis or treatment, which is an ethical failure in patient advocacy and safety. Another incorrect approach would be to use outdated or regionally specific anatomical terms that may not be universally understood by all members of the interdisciplinary team, including specialists from different backgrounds or institutions. This can create barriers to effective collaboration and compromise patient care, representing a failure to uphold professional communication standards. Professionals should employ a decision-making framework that prioritizes clarity, accuracy, and standardization in anatomical communication. This involves actively using and verifying the understanding of precise anatomical terminology, especially in critical situations. When in doubt, seeking clarification or confirming understanding with colleagues is essential. This systematic approach ensures that all communication is precise, unambiguous, and contributes to the highest standard of patient care. Question 4. Operational review demonstrates that a critical care registered nurse is caring for a patient with a chronic respiratory condition. The physician's progress note states the patient is experiencing an acute exacerbation. The nurse, while familiar with the general meaning of this term, is unsure of the specific clinical indicators the physician is referring to in this particular patient's case, which could influence immediate nursing interventions. What is the most appropriate course of action for the nurse? Option A. Discuss the term with a more experienced nurse on the unit to gain their interpretation before acting. Option B. Assume the physician is referring to a common presentation of the condition and initiate interventions based on that assumption. Option C. Document the term acute exacerbation in the patient's chart and proceed with standard nursing interventions for this condition. Option D. Seek immediate clarification from the physician regarding the specific clinical manifestations and implications of the acute exacerbation for this patient. The correct answer is D. Seek immediate clarification from the physician regarding the specific clinical manifestations and implications of the acute exacerbation for this patient. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of critical medical terminology, which can directly impact patient care and safety. The nurse's responsibility is to ensure accurate communication of patient status and needs, especially in a high-stakes critical care environment. Ambiguity in terminology can lead to delayed or inappropriate interventions, potentially causing harm. Correct approach analysis. The correct approach involves seeking clarification from the physician regarding the specific meaning of acute exacerbation in the context of the patient's presentation. This aligns with the professional obligation to ensure understanding of medical orders and patient conditions. In the U.S. regulatory framework, this is supported by the principles of patient safety and the nurse's role in the interdisciplinary healthcare team, as outlined by organizations like the American Nurses Association, ANA, Code of Ethics for Nurses, which emphasizes the nurse's duty to advocate for patients and ensure safe, competent, and ethical care. Accurate communication is a cornerstone of this. Incorrect approach is analysis, One incorrect approach is to assume the meaning of acute exacerbation based on general knowledge. This fails to acknowledge the nuances of individual patient conditions and the specific context of the physician's assessment. Ethically, this demonstrates a lack of due diligence and can lead to a breakdown in communication, violating the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also potentially violates Joint Commission standards related to communication and patient safety. Another incorrect approach is to document the term without full understanding, hoping it will become clear later. This is a failure to actively participate in patient care and communication. It creates a record that may be inaccurate or misleading, impacting continuity of care and potentially leading to future errors. This contravenes the professional standard of accurate and timely documentation, which is a legal and ethical requirement. A further incorrect approach is to discuss the term with colleagues without first clarifying with the physician. While collegial discussion can be helpful, it should not replace direct clarification of a physician's order or assessment. This can lead to the spread of misinformation and does not resolve the core issue of understanding the physician's intent. It bypasses the primary communication channel and can undermine the physician-patient-nurse relationship. Professional reasoning. Professionals should employ a systematic approach to communication. When encountering unfamiliar or potentially ambiguous medical terminology, the first step is to seek direct clarification from the source, in this case, the physician. This ensures accuracy and allows for timely and appropriate interventions. If clarification is still needed after the initial discussion, further consultation with a supervisor or relevant specialist may be warranted. Documentation should always reflect a clear and accurate understanding of the patient's condition and the plan of care. Question 5. The assessment process reveals a patient's chart with the following notations: acute myocardial infarction, pulmonary edema, sepsis, and acute respiratory distress syndrome. Which of the following interpretations best reflects the critical care registered nurse's understanding of the patient's complex condition? Option A. The patient is suffering from a heart problem, fluid buildup, a bacterial issue, and lung failure. Option B. The patient is experiencing a heart attack, fluid in the lungs, a systemic infection, and severe lung inflammation. Option C. The patient has a chest pain episode, wet lungs, a germ problem, and trouble breathing. Option D. The patient has a cardiac event, lung congestion, a blood infection, and breathing difficulties. The correct answer is B. The patient is experiencing a heart attack, fluid in the lungs, a systemic infection, and severe lung inflammation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the critical care registered nurse, CCRN, to interpret and act upon a complex set of medical terms that span multiple specialties, directly impacting patient care and safety. Misinterpreting any term could lead to incorrect interventions, delayed treatment, or adverse patient outcomes. The CCRN must possess a robust understanding of these terms to effectively communicate with the interdisciplinary team and advocate for the patient. Correct approach analysis. The correct approach involves accurately identifying and understanding the meaning of each medical term presented, recognizing their implications within the critical care context. This demonstrates adherence to professional standards of practice, which mandate competent and knowledgeable care. By correctly interpreting terms like pulmonary edema, fluid accumulation in the lungs, and myocardial infarction, heart attack, the CCRN can anticipate potential complications, implement appropriate monitoring, and collaborate effectively with physicians and other specialists. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approach is analysis, an approach that focuses solely on the most alarming term without considering the interconnectedness of all terms, risks, incomplete assessment, and management. For example, focusing only on sepsis, without understanding the contributing factors indicated by other terms, might lead to a narrow treatment plan. This could violate the standard of care by failing to address the full clinical picture. Another incorrect approach would be to rely on assumptions or incomplete knowledge of a specific specialty's terminology. For instance, misinterpreting acute respiratory distress syndrome, ARDS, as simple pneumonia could lead to inadequate ventilatory support and management, potentially causing significant harm and violating the duty of care. Finally, an approach that prioritizes patient comfort over accurate medical interpretation, without a clear clinical rationale or physician order, would be professionally unacceptable. While patient comfort is paramount, it must be balanced with the need for precise medical management based on accurate understanding of the patient's condition. This could be seen as a failure to uphold professional responsibilities and potentially lead to adverse events. Professional reasoning. The professional decision-making process in this situation involves a systematic approach. 1. Comprehensive review. Read and understand all provided medical terms. 2. Specialty contextualization. Identify the specialty associated with each term and its relevance to the critical care setting. 3. Interconnection analysis. Determine how the terms relate to each other and the patient's overall condition. 4. Clinical implication assessment. Evaluate the immediate and potential future implications of each term for patient care. 5. Collaborative communication. Formulate clear and concise communication points for the interdisciplinary team. 6. Evidence-based intervention. Ensure all actions taken are supported by current evidence-based practice and physician orders. Question 6. The audit findings indicate a discrepancy in the reporting of critical care services, with some claims lacking sufficient documentation to support the level of care billed. Which of the following approaches best aligns with regulatory guidelines for coding and reporting critical care services in the United States? Option A. Assigning critical care codes based on the general impression of the patient's severity of illness, as perceived by the nursing staff, without a detailed review of specific documented interventions. Option B. Coding critical care services based on the physician's dictated summary of the encounter, even if the detailed nursing notes and monitoring data do not fully corroborate the described intensity of care. Option C. Reviewing the patient's medical record to identify and document all critical care interventions, physiological monitoring, and time spent by the physician and nursing staff, ensuring these elements meet the criteria for critical care coding as defined by CMS guidelines. Option D. Utilizing historical coding patterns for similar patient encounters, assuming the level of care provided was consistent, and applying those codes to current claims. The correct answer is C. Reviewing the patient's medical record to identify and document all critical care interventions, physiological monitoring, and time spent by the physician and nursing staff, ensuring these elements meet the criteria for critical care coding as defined by CMS guidelines. Explanation. The audit findings indicate a pattern of inconsistent coding and reporting of critical care services, leading to potential under- or over-reimbursement and compliance risks. This scenario is professionally challenging because it requires the critical care registered nurse to navigate complex coding guidelines, understand the nuances of documentation requirements, and ensure accurate reflection of the patient's acuity and the services provided. The pressure to maintain efficient workflows while adhering to strict regulatory standards adds another layer of complexity. The correct approach represents best professional practice because it prioritizes accurate and compliant coding based on established regulatory frameworks, such as the Centers for Medicare and Medicaid Services, CMS, guidelines for critical care services. This involves meticulous review of the medical record to ensure all elements required for coding are present and correctly documented. Adherence to these guidelines ensures that reimbursement accurately reflects the intensity of care provided, supports quality reporting, and mitigates the risk of audits and penalties. It demonstrates a commitment to ethical practice and financial stewardship. An incorrect approach that involves coding based solely on the perceived acuity of the patient, without thorough documentation review, fails to meet regulatory requirements. This can lead to inaccurate claims, potential fraud and abuse investigations, and financial repercussions for the healthcare facility. Another incorrect approach, such as relying on historical coding patterns without validating current documentation, ignores the dynamic nature of patient care and the evolving coding rules, thereby increasing compliance risk. Furthermore, an approach that prioritizes speed over accuracy, leading to the use of generic or unverified codes, directly violates the principles of precise medical record documentation and coding integrity. Professionals should employ a decision-making framework that begins with a thorough understanding of the relevant coding and reporting guidelines. This involves regularly reviewing updates from regulatory bodies and professional organizations. When faced with documentation that is unclear or incomplete, the professional should seek clarification from the treating physician or other appropriate clinical staff. A systematic review of the patient's chart, focusing on specific documentation elements required for critical care coding, e.g., time spent, interventions performed, physiological monitoring, is crucial. Finally, maintaining a culture of continuous learning and quality improvement in coding practices is essential for sustained compliance and accurate reporting. Question 7. Strategic planning requires a critical care registered nurse to assess and manage a patient with a severe pelvic inflammatory disease complicated by sepsis, who has a stated desire to conceive in the future. What approach best integrates the patient's reproductive health goals with her immediate critical care needs, adhering to U.S. regulatory and ethical standards? Option A. Initiate a comprehensive reproductive health assessment, including a discussion of fertility preservation options and potential long-term impacts of current treatments on future conception, while concurrently managing sepsis with the guidance of reproductive specialists. Option B. Delegate the discussion of reproductive health to the primary medical team without direct involvement from the critical care nurse, as reproductive health falls outside the scope of critical care nursing expertise. Option C. Prioritize aggressive sepsis management and fluid resuscitation, deferring any discussion of reproductive health until the patient is stabilized and transferred out of the ICU, as reproductive concerns are secondary to life-saving measures. Option D. Focus solely on the immediate management of sepsis and organ support, assuming that the patient's reproductive desires are not a priority given the severity of her critical illness, and that fertility will be addressed post-discharge. The correct answer is C. Prioritize aggressive sepsis management and fluid resuscitation, deferring any discussion of reproductive health until the patient is stabilized and transferred out of the ICU, as reproductive concerns are secondary to life-saving measures. Explanation: the scenario presents a critical care registered nurse, CCRN, managing a patient with a complex reproductive system issue, requiring a nuanced approach that balances immediate clinical needs with long-term patient well-being and reproductive health considerations. The challenge lies in integrating specialized reproductive care within the high-acuity environment of the ICU, ensuring that interventions do not inadvertently compromise future reproductive capacity or patient autonomy regarding reproductive choices. The correct approach prioritizes a comprehensive assessment that includes understanding the patient's reproductive history, current reproductive status, and future reproductive desires. This aligns with the ethical principles of beneficence and patient autonomy, as well as regulatory guidelines that emphasize holistic patient care and informed consent. Specifically, in the U.S. regulatory framework for nursing practice, adherence to the American Nurses Association (ANA) Code of Ethics for Nurses is paramount. This code mandates that nurses respect the patient's right to self-determination, which extends to reproductive health decisions. Furthermore, the Health Insurance Portability and Accountability Act (HIPAA) ensures the privacy of protected health information, including sensitive reproductive health details. A CCRN must advocate for the patient's reproductive health needs, collaborating with reproductive endocrinologists or gynecologists when necessary, and ensuring that all care decisions are made with the patient's informed consent, considering potential impacts on fertility and pregnancy. An incorrect approach would be to solely focus on the immediate life-sustaining interventions, without considering the reproductive implications. This could lead to interventions that, while medically necessary in the short term, have detrimental long-term effects on reproductive function, violating the principle of non-maleficence and potentially infringing on patient autonomy if reproductive desires were not explored. Another incorrect approach would be to make assumptions about the patient's reproductive goals without direct communication, which is a failure of patient-centered care and informed decision-making. Failing to involve reproductive specialists when indicated would also be a regulatory and ethical failure, as it demonstrates a lack of comprehensive care and potentially inadequate expertise in managing complex reproductive issues within critical care. The professional decision-making process for similar situations involves a systematic approach. 1. Recognize the potential impact of critical illness and its treatment on reproductive health. 2. Conduct a thorough assessment of the patient's reproductive status and desires, ensuring privacy and sensitivity. 3. Consult with relevant specialists, e.g., reproductive endocrinologists, gynecologists as needed. 4. Engage in open and honest communication with the patient and their family, as appropriate and with patient consent, regarding treatment options and their reproductive implications. 5. Document all assessments, consultation, and patient decisions meticulously. 6. Advocate for the patient's reproductive health needs within the interdisciplinary team, ensuring that reproductive considerations are integrated into the overall care plan. Question 8. Stakeholder feedback indicates that critical care registered nurses are sometimes involved in the initial review of diagnostic reports for neoplasms to ensure appropriate follow-up and documentation. When reviewing a pathology report that describes a moderately differentiated adenocarcinoma arising in the sigmoid colon, which of the following actions best reflects adherence to regulatory frameworks for accurate neoplasm coding? Option A. Assigning a code for a benign neoplasm of the colon as moderately differentiated suggests a less aggressive form. Option B. Using a previous coding manual from a prior year to code the diagnosis, as the facility's coding practices have historically been consistent. Option C. Coding based on the physician's brief summary note in the patient's chart, assuming it captures all essential details for coding. Option D. Assigning a code for malignant neoplasm of the colon, specifying the sigmoid as the site, based on the term adenocarcinoma and its location. The correct answer is D. Assigning a code for malignant neoplasm of the colon, specifying the sigmoid as the site, based on the term adenocarcinoma and its location. Explanation. Scenario analysis. This scenario is professionally challenging because accurate coding for neoplasms is critical for patient care, billing, research, and regulatory compliance. Misinterpretation of diagnostic reports or failure to apply current coding guidelines can lead to significant downstream consequences, including incorrect treatment planning, financial penalties, and flawed statistical data. The complexity arises from the nuanced language in pathology reports, the need to understand the morphology and behavior of the neoplasm, and the requirement to adhere to specific coding conventions. Correct approach analysis. The correct approach involves a thorough review of the pathology report, cross-referencing diagnostic terms with the official coding manual, e.g., IC 10cm in the US, and applying specific coding rules for neoplasms. This ensures that the code accurately reflects the primary site, histology, behavior, benign, malignant, in situ, and any relevant staging or secondary sites. Adherence to these guidelines is mandated by regulatory bodies, e.g., Centers for Medicare and Medicaid Services in the U.S., and is essential for accurate reimbursement and data integrity. This systematic process minimizes errors and upholds professional standards for documentation and reporting. Incorrect approaches analysis. Coding based solely on the physician's summary without consulting the detailed pathology report is an ethical and regulatory failure. Summary may omit crucial details about the neoplasm's characteristics necessary for accurate coding. Relying on outdated coding manuals or internal facility guidelines that do not reflect the latest official updates is also a failure, as it violates current regulatory requirements and can lead to inaccurate coding and potential noncompliance. Assigning a code based on a similar but not identical diagnosis is a significant error, as it misrepresents the patient's condition and can impact treatment and outcomes. This is a failure to adhere to the principle of specificity in medical coding. Professional reasoning. Professionals should adopt a systematic approach to neoplasm coding. This involves 1. Thoroughly reviewing all available documentation, prioritizing the pathology report. 2. Identifying key terms related to site, histology, and behavior. 3. Consulting the current official coding manual, e.g., IC 10cm, and its specific chapters or sections on neoplasms. 4. Applying coding guidelines and conventions meticulously, paying attention to sequencing rules and any instructional notes. 5. Seeking clarification from the physician or a coding expert if any ambiguity exists in the documentation. This methodical process ensures accuracy, compliance, and ethical practice. Question 9. The risk matrix shows a high likelihood of respiratory compromise in a postoperative patient with a history of obstructive sleep apnea who is receiving opioid analgesia. Which of the following nursing approaches best mitigates this risk while ensuring adequate pain management? Option A. Implement a multimodal pain management plan incorporating non-pharmacological interventions and opioid-sparing adjuncts, coupled with continuous respiratory monitoring including capnography and pulse oximetry. Option B. Administer opioid analgesia as prescribed, relying on routine vital sign checks to monitor for respiratory depression. Option C. Administer opioid analgesia as the primary pain management strategy and increase the frequency of respiratory assessments only if the patient reports increased pain. Option D. Withhold all opioid analgesia to eliminate the risk of respiratory depression. focusing solely on non-pharmacological pain relief. Correct answer is A. Implement a multimodal pain management plan incorporating non-pharmacological interventions and opioid-sparing adjuncts, coupled with continuous respiratory monitoring including capnography and pulse oximetry. Explanation: the risk matrix shows a high likelihood of respiratory compromise in a postoperative patient with a history of obstructive sleep apnea, OSA, who is receiving opioid analgesia. This scenario is professionally challenging due to the inherent conflict between managing postoperative pain effectively and the significant risk of opioid-induced respiratory depression, particularly in a patient with pre-existing OSA. The nurse must balance the patient's comfort and pain control with the critical need to maintain adequate ventilation and oxygenation, adhering to established critical care standards and patient safety protocols. Correct approach represents best professional practice because it prioritizes proactive monitoring and intervention based on identified risk factors. This aligns with the principles of patient safety and evidence-based practice mandated by nursing regulatory bodies. Specifically, it involves implementing a multimodal pain management strategy that minimizes opioid reliance, utilizing non-pharmacological interventions, and employing opioid-sparing adjuncts. Furthermore, it necessitates close and continuous respiratory monitoring, including capnography and pulse oximetry, with a low threshold for escalating care or administering reversal agents if signs of respiratory depression emerge. This approach is consistent with guidelines from professional organizations such as the American Association of Critical Care Nurses, ACN, which emphasize vigilant assessment and timely intervention to prevent adverse events. An incorrect approach that involves administering opioids as the primary pain management strategy without considering the patient's OSA history or implementing enhanced monitoring fails to meet professional standards. This constitutes a regulatory failure by not adhering to best practices for patient safety and risk mitigation. Ethically, it breaches the duty of care by exposing the patient to an unacceptable level of risk. Another incorrect approach, which is to withhold all opioid analgesia due to the perceived risk, is also professionally unacceptable. This fails to adequately address the patient's legitimate need for pain relief, potentially leading to undertreatment of pain, which can have its own negative physiological and psychological consequences, including delayed recovery and increased risk of complications. This represents a failure to provide holistic and patient-centered care. A further incorrect approach, such as relying solely on intermittent vital sign checks without continuous monitoring or specific respiratory assessments, is insufficient given the high-risk profile. This passive approach does not align with the proactive, vigilant monitoring required in critical care settings for patients at risk of respiratory compromise. It is a failure to implement appropriate nursing interventions based on a thorough risk assessment. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive risk assessment. Identify all patient-specific risk factors for respiratory compromise. 2. Evidence-based intervention planning. Select pain management strategies that are effective and minimize risk, incorporating multimodal approaches. 3. Proactive monitoring strategy. Establish a clear plan for continuous and targeted monitoring of respiratory status. 4. Escalation protocol. Define clear triggers for escalating care and the interventions to be implemented. 5. Communication. Ensure clear communication with the interdisciplinary team regarding the patient's risk and management plan. Question 10. The risk matrix shows a high probability of patient misunderstanding regarding a proposed invasive procedure due to the physician's use of complex pathophysiological terminology. The patient appears anxious but has not explicitly refused the procedure. As the critical care registered nurse, what is the most ethically appropriate immediate action? Option A. Proceed with obtaining the patient's consent as documented by the physician, assuming the patient understands the implications of the terminology used. Option B. Politely interrupt the physician to request a simplified explanation of the procedure's risks, benefits, and alternatives, and then assess the patient's comprehension before consent is finalized. Option C. Document the physician's explanation in the patient's chart and proceed with the procedure if the patient verbally agrees without further clarification. Option D. Inform the physician that the patient is not capable of understanding the information and that a surrogate decision maker must be involved. The correct answer is B. Politely interrupt the physician to request a simplified explanation of the procedure's risks, benefits, and alternatives, and then assess the patient's comprehension before consent is finalized. Explanation. Scenario analysis. This scenario presents a significant ethical dilemma for a critical care registered nurse, CCRN. The challenge lies in balancing the patient's right to autonomy and informed consent with the nurse's professional responsibility to advocate for the patient's best interests, especially when the patient's capacity to make decisions is compromised due to their critical illness. The use of complex pathophysiological terminology by the physician, without adequate explanation or assessment of the patient's comprehension, creates a barrier to true informed consent, placing the nurse in a position of ethical conflict. The nurse must navigate the potential for patient harm resulting from a lack of understanding, while respecting the physician-patient relationship and the patient's expressed wishes. Correct approach analysis. The correct approach prioritizes patient advocacy and the ethical principle of beneficence, while upholding the patient's right to autonomy as much as possible. By seeking clarification of the complex terminology and assessing the patient's understanding, the CCRN ensures that the patient can make a truly informed decision, or that appropriate surrogate decision-makers are engaged if the patient lacks capacity. This aligns with the American Nurses Association, ANA Code of Ethics, which emphasizes the nurse's role in advocating for patients, promoting their health and safety, and respecting their dignity and self-determination. It also reflects the principles of patient-centered care, which require clear communication and shared decision-making. The nurse's action of facilitating understanding before consent is obtained is a direct application of ensuring the patient's right to self-governance is respected. Incorrect approaches analysis. One incorrect approach involves proceeding with the procedure without ensuring the patient's comprehension. This violates the ethical principle of autonomy, as consent obtained without understanding is not truly informed. It also potentially breaches the nurse's duty of care, as it could lead to patient harm if the patient agrees to a treatment they do not fully grasp the implications of. This approach disregards the nurse's ethical obligation to advocate for the patient and ensure their safety and well-being. Another incorrect approach would be to override the patient's wishes based on the nurse's own interpretation of what is best, without a formal assessment of capacity or consultation with the medical team and potentially a surrogate. While the nurse may have concerns, unilateral decision-making in this context is ethically unsound and could lead to legal repercussions. It undermines the patient's right to make choices about their own body and care, even if those choices are not what the nurse would personally make. This also bypasses established protocols for managing patients with diminished capacity. A third incorrect approach might be to simply document the physician's explanation without verifying the patient's understanding. This abdicates the nurse's responsibility to ensure the patient is truly informed and could be seen as complicity in obtaining inadequate consent. The nurse has an independent ethical duty to assess the patient's comprehension and advocate for clear communication, not just passively record information. Professional reasoning. When faced with complex medical information and potential communication barriers, a CCRN should employ a systematic approach. First, identify the ethical conflict, patient autonomy versus beneficence, complicated by communication challenges. Second, assess the patient's current state and capacity for decision-making. Third, advocate for clear, understandable communication by the physician, requesting the physician to rephrase or simplify explanations. If the patient still struggles to understand, the nurse should facilitate a discussion with the physician to ensure all questions are answered and the patient grasps the risks, benefits, and alternatives. If capacity remains a concern, the nurse should initiate the process for involving a surrogate decision-maker or ethics committee consultation, adhering to institutional policy and legal frameworks. The ultimate goal is to ensure that any decision made by or on behalf of the patient is as informed and ethically sound as possible. Question 11. Operational review demonstrates a critical care patient presenting with sudden onset of dyspnea, altered mental status, and a significant drop in blood pressure. Which integrated approach to assessing the patient's human body systems is most crucial for immediate and effective management? Option A. Prioritization of neurological assessment due to the altered mental status. Option B. Simultaneous evaluation of cardiovascular, respiratory, and neurological system function. Option C. Exclusive focus on the respiratory system to address the primary complaint of dyspnea. Option D. Isolated assessment of the cardiovascular system to identify the cause of hypotension. Correct answer is B. Simultaneous evaluation of cardiovascular, respiratory, and neurological system function. Explanation. Scenario analysis. This scenario presents a challenge in critical care nursing, where a patient's complex presentation requires a nuanced understanding of multiple interconnected human body systems. The nurse must synthesize information from various physiological domains to accurately assess the patient's condition and anticipate potential complications. This requires not just knowledge of individual systems, but also an appreciation for how their dysfunctions can synergistically impact the patient's overall status. Correct approach analysis. The correct approach involves a systematic and integrated assessment of the cardiovascular, respiratory, and neurological systems. This aligns with best professional practice as outlined by nursing standards of care, which emphasize a holistic patient assessment. Specifically, understanding the interplay between these systems is crucial in critical care. For instance, compromised respiratory function can lead to hypoxemia, which directly impacts myocardial oxygen supply and can precipitate arrhythmias or myocardial ischemia. Neurological compromise, such as increased intracranial pressure, can trigger the Cushing's reflex, affecting heart rate and blood pressure, further stressing the cardiovascular system. This integrated approach allows for early identification of cascading failures and facilitates timely, targeted interventions, thereby upholding the ethical principle of beneficence and non-maleficence by prioritizing patient safety and well-being. Incorrect approaches analysis. An approach focusing solely on the respiratory system, while important, fails to acknowledge the potential for concurrent cardiovascular or neurological issues to exacerbate respiratory distress or be a primary driver of the patient's symptoms. This narrow focus risks overlooking critical underlying pathologies or contributing factors, violating the principle of providing comprehensive care. An approach that prioritizes only the neurological assessment, without considering the impact of potential hypoxemia or hemodynamic instability on brain function, is also inadequate. The brain is highly sensitive to oxygen and perfusion, and neglecting these factors can lead to misinterpretation of neurological signs or delayed treatment of life-threatening conditions. This constitutes a failure to provide safe and effective nursing care. An approach that exclusively examines the cardiovascular system without assessing respiratory status or neurological function is similarly flawed. For example, a patient with a myocardial infarction may present with altered mental status due to reduced cerebral perfusion or respiratory distress due to pulmonary edema. Ignoring these interconnected systems would lead to an incomplete picture and potentially inappropriate management. Professional reasoning. Professionals should employ a systematic head-to-toe assessment framework, but with a critical care lens that emphasizes the interconnectedness of body systems. This involves 1. Actively seeking and integrating data from all relevant systems, recognizing that a change in one system often impacts others. 2. Prioritizing assessments based on the patient's presenting symptoms and known critical care conditions. 3. Utilizing critical thinking to hypothesize potential diagnoses and differential diagnoses by considering system interactions. 4. Collaborating with the interdisciplinary team to validate assessments and treatment plans. This decision-making process ensures a comprehensive and patient-centered approach, adhering to professional standards and ethical obligations. Question 12. Quality control measures reveal that a critical care registered nurse has managed a patient requiring a complex intervention that does not have a readily identifiable billing code within the facility's standard procedural nomenclature. The nurse has performed the intervention to address an immediate, life-threatening patient need. What is the most appropriate course of action for the nurse to ensure regulatory compliance and proper patient care documentation? Option A. Proceed with documenting the intervention using the closest available code, assuming it will be sufficient for billing and record-keeping purposes. Option B. Immediately consult with the physician and the facility's billing and coding department to determine the appropriate documentation and coding strategy for this unlisted service, ensuring patient care is not compromised. Option C. Document the intervention as a provider discretion service without further consultation, relying on the physician's judgment alone. Option D. Delay further patient care until a specific billing code for the intervention can be researched and officially assigned by an external regulatory body. The correct answer is B. Immediately consult with the physician and the facility's billing and coding department to determine the appropriate documentation and coding strategy for this unlisted service, ensuring patient care is not compromised. Explanation: this scenario is professionally challenging because it involves a critical care registered nurse, CCRN, encountering a situation where a patient requires a procedure or service that is not explicitly listed in the facility's established billing codes or protocols. This ambiguity creates a risk of inadequate patient care, improper documentation, and potential financial discrepancies if not handled correctly. The CCRN must balance immediate patient needs with the need for accurate and compliant administrative processes. The correct approach represents best professional practice because it prioritizes patient safety and ethical care while adhering to regulatory frameworks. By consulting with the interdisciplinary team, including physicians and the billing department, the CCRN ensures that the unlisted procedure is properly evaluated, documented, and coded according to established guidelines for novel or unusual services. This collaborative process safeguards against misinterpretation, ensures appropriate reimbursement, and maintains the integrity of patient records, aligning with the principles of patient advocacy and professional accountability mandated by nursing practice acts and healthcare regulations. An incorrect approach of performing the procedure without seeking clarification or proper documentation is a significant regulatory and ethical failure. It bypasses established protocols designed to ensure patient safety and accurate billing, potentially leading to a lack of oversight for the unlisted service. This could result in inadequate care if the procedure is not fully understood or if necessary follow-up is not planned. Furthermore, it violates principles of transparency and accountability in healthcare billing and record-keeping, potentially leading to audits, fines, and damage to the facility's reputation. Another incorrect approach of delaying the procedure until a specific code is found is also professionally unacceptable. While adherence to protocol is important, patient well-being in a critical care setting is paramount. Delaying unnecessary intervention due to administrative hurdles can have severe consequences for the patient's health status and outcomes. This demonstrates a failure to prioritize patient needs and a lack of critical thinking in navigating complex healthcare systems. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the immediate patient need and the urgency of the unlisted procedure or service. 2. Consult with the ordering physician to understand the clinical rationale and expected outcomes. 3. Engage the interdisciplinary team, including nursing leadership, risk management, and the billing department, to discuss the unlisted nature of the service. 4. Research available resources and guidelines for coding and documenting novel or unlisted procedures, often found in professional coding manuals or through payer-specific guidance. 5. Document the procedure thoroughly, including the rationale for its performance, the steps taken, and any consultations or decisions made regarding its classification. 6. Advocate for the patient by ensuring that the service is appropriately recognized and accounted for, even if it requires a non-standard coding approach. Question 13. Assessment of a critically ill patient reveals documented social isolation and a history of food insecurity, both of which are noted to be impacting the patient's adherence to prescribed post-discharge dietary recommendations. Which coding approach best reflects the regulatory framework for capturing factors influencing health status in this scenario? Option A. Exclude codes for social isolation and food insecurity, as they are not the primary diagnoses for critical care admission. Option B. Assign ICD-10-CM codes for social isolation and food insecurity, as they directly influence the patient's current management and future care needs. Option C. Assign codes for social isolation and food insecurity only if they are the direct cause of the critical illness. Option D. Document the social factors but refrain from assigning specific ICD-10-CM codes, relying solely on narrative descriptions. The correct answer is B. Assign ICD-10-CM codes for social isolation and food insecurity, as they directly influence the patient's current management and future care needs. Explanation: scenario analysis. This scenario is professionally challenging because accurately coding for factors influencing health status, often referred to as social determinants of health or non-medical factors, requires a nuanced understanding of patient circumstances beyond immediate clinical presentation. Critical care nurses must identify and document these factors to ensure comprehensive patient care, appropriate resource allocation, and accurate data for quality improvement and research. The challenge lies in recognizing these factors during intense, high-acuity care and translating them into appropriate diagnostic codes, which can impact reimbursement, public health initiatives, and the overall understanding of patient outcomes. Correct approach analysis. The correct approach involves utilizing established coding guidelines and clinical documentation to identify and assign ICD-10-CM codes for conditions that, while not the primary reason for admission, significantly impact the patient's care, management, or prognosis. This aligns with the principles of accurate and complete medical record keeping, which is a regulatory requirement for healthcare providers. Specifically, the Centers for Medicare and Medicaid Services, CMS, emphasizes the importance of capturing all conditions that affect patient care. For example, codes for homelessness, lack of social support, or substance abuse can trigger specific care management protocols and highlight the need for multidisciplinary interventions. This approach ensures that the patient's holistic health status is represented, leading to better informed clinical decisions and more accurate data for population health analysis. Incorrect approaches analysis. One incorrect approach is to solely focus on the acute diagnosis for which the patient was admitted, ignoring other documented conditions that influence care. This fails to meet regulatory requirements for comprehensive coding and can lead to an incomplete picture of the patient's health needs, potentially impacting future care planning and resource allocation. Ethically, it can result in underestimating the complexity of patient care. Another incorrect approach is to assign codes based on assumptions or incomplete documentation. For instance, coding for a social determinant without clear evidence in the medical record is a violation of coding integrity and can lead to inaccurate data. This practice is ethically unsound and can have financial and legal repercussions for the healthcare facility. A third incorrect approach is to avoid coding any non-acute conditions, even if they are clearly documented and impact care, due to a perception that they are not medical issues. This misunderstands the scope of ICD-10-CM coding, which is designed to capture all factors influencing health status. Regulatory bodies expect these factors to be coded to understand the full spectrum of patient needs and outcomes. Professional reasoning. Professionals should employ a systematic approach to documentation and coding. This involves actively listening to patient and family reports, reviewing all available clinical notes, including social work and case management, and collaborating with the interdisciplinary team. When a factor is identified that influences care, the nurse should ensure it is clearly documented in the patient's record. Subsequently, the coding professional, guided by the documented information and official coding guidelines, will assign the appropriate ICD-10-CM codes. This process ensures that all relevant health status factors are captured accurately and ethically, adhering to regulatory mandates and promoting optimal patient care. Question 14. Comparative studies suggest that the structure and formatting of CPT codes significantly impact the accuracy of critical care service documentation. When faced with a complex critical care scenario involving multiple interventions and organ system support, which approach best ensures compliant and accurate CPT code assignment? Option A. Thoroughly reviewing the CPT manual's introductory guidelines, parenthetical instructions, and specific code definitions, ensuring all criteria for the selected code are met within the documented clinical context. Option B. Utilizing CPT codes for individual interventions performed during the critical care encounter, assuming each distinct action warrants a separate code regardless of bundling rules. Option C. Relying on the general understanding of critical care services and assigning a code that broadly encompasses the patient's condition, assuming that minor discrepancies in documentation are acceptable. Option D. Prioritizing the selection of the most frequently used CPT code for critical care services based on common practice, without extensive review of specific code guidelines. The correct answer is D. Prioritizing the selection of the most frequently used CPT code for critical care services based on common practice, without extensive review of specific code guidelines. Explanation. Scenario analysis. This scenario is professionally challenging because accurately documenting critical care interventions is paramount for patient safety, reimbursement, and legal defensibility. Misinterpreting or misapplying CPT, current procedural terminology, codes can lead to under or overbilling, impacting healthcare facility revenue and potentially triggering audits. Furthermore, incorrect coding can obscure the true complexity of care provided, affecting quality metrics and future resource allocation. The critical care nurse must possess a nuanced understanding of CPT structure and formatting to ensure precise and compliant documentation. Correct approach analysis. The correct approach involves a thorough understanding of the CPT manual's organizational structure, including its introductory guidelines, parenthetical instructions, and the specific definitions and inclusions/exclusions for each code. This approach ensures that the nurse is not only selecting a code that broadly describes an intervention, but is also adhering to the precise requirements for its use. For example, understanding that CPT codes for critical care services often have specific time-based requirements or require documentation of specific organ system support is crucial. This aligns with the regulatory framework that mandates accurate and complete medical record documentation, which directly supports appropriate billing and coding practices. Adherence to these guidelines prevents fraudulent billing and ensures that the healthcare facility is reimbursed for the actual services rendered, reflecting the acuity and complexity of the patient's condition. Incorrect approach is analysis. One incorrect approach is relying solely on the code description without consulting the accompanying guidelines or parenthetical notes. This can lead to selecting a code that appears to fit but fails to meet specific criteria, such as time thresholds or the exclusion of certain bundled services. This violates regulatory requirements for accurate coding and can result in improper billing, potentially leading to penalties. Another incorrect approach is to assume that a common intervention always maps to the same CPT code, regardless of the patient's clinical context or the specific details of the intervention. Critical care coding is highly context-dependent. Failing to consider the nuances of the patient's condition and the specific actions taken, as detailed in the CPT manual, can lead to code misuse. This is a failure to comply with the principle of documentation supports the code, a cornerstone of compliant billing and a regulatory expectation. A third incorrect approach is to use codes for services that are bundled into critical care codes without proper understanding of CPT's bundling rules. Many services performed during critical care are considered integral to the critical care encounter and are not separately billable. Using these codes inappropriately constitutes an ethical and regulatory violation, as it represents an attempt to bill for services already compensated within the critical care code. Professional reasoning. Professionals should approach CPT coding by first identifying the core intervention or service provided. They should then consult the CPT manual, starting with the relevant section, e.g., medicine, surgery, or specific critical care codes. It is essential to read the introductory guidelines for the relevant section and then carefully examine the chosen code's description, paying close attention to any parenthetical notes, includes, excludes, and use additional code instructions. If there is any ambiguity, consulting official CPT coding resources, payer guidelines, or a certified professional coder is recommended. This systematic approach ensures accuracy, compliance, and ethical practice. Question 15. The performance metrics show an increase in the incidence of pressure injuries on the sacrum and heels among patients admitted to the critical care unit. As the charge nurse, what is the most appropriate immediate action to address this trend? Option A. Advise the nursing staff to only reposition patients when they express discomfort or are visibly showing signs of skin redness. Option B. Delegate the responsibility for all pressure injury prevention interventions to the unlicensed assistive personnel, ensuring they are aware of the increased incidence. Option C. Conduct a unit-wide audit of current skin care protocols, review patient risk assessments, and reinforce evidence-based pressure injury prevention strategies with all staff. Option D. Instruct the nursing staff to increase the frequency of visual skin checks for all patients, focusing on bony prominences. The correct answer is C. Conduct a unit-wide audit of current skin care protocols, review patient risk assessments, and reinforce evidence-based pressure injury prevention strategies with all staff. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for rapid deterioration of skin integrity in critically ill patients, coupled with the inherent complexities of managing multiple comorbidities and the need for constant vigilance. The critical care environment demands immediate and accurate assessment and intervention to prevent adverse outcomes, such as pressure injuries, which can significantly impact patient recovery, increase length of stay, and lead to serious infections. The challenge lies in balancing the need for timely interventions with the resource constraints and the dynamic nature of patient conditions. Correct approach analysis. The correct approach, which involves a comprehensive skin assessment utilizing a validated tool, implementing a turning and repositioning schedule based on the patient's risk stratification, and ensuring adequate nutrition and hydration, represents best professional practice. This aligns with established guidelines from organizations like the Agency for Healthcare Research and Quality (OGQ) and the National Pressure Ulcer Advisory Panel (NPUA) in the United States, which are foundational for critical care nursing practice. These guidelines emphasize a proactive, evidence-based approach to pressure injury prevention. Regulatory frameworks, such as those enforced by the Centers for Medicare and Medicaid Services (CMS), often tie reimbursement to the prevention of hospital-acquired conditions, including pressure injuries, underscoring the regulatory imperative for such practices. Ethically, this approach upholds the principle of beneficence by actively working to prevent harm and non-maleficence by avoiding preventable complications. Incorrect approaches analysis. An approach that relies solely on visual inspection without a standardized tool fails to provide objective data for tracking changes and identifying subtle signs of skin compromise, potentially leading to delayed interventions. This deviates from best practice by not utilizing validated assessment methods, which are often implicitly or explicitly expected by regulatory bodies focused on quality of care. Another incorrect approach, which involves repositioning the patient only when visible signs of redness or breakdown are apparent, is reactive rather than proactive. This approach ignores the early stages of pressure injury development, which are often reversible with timely intervention. Regulatory bodies and professional standards emphasize prevention, and a reactive approach can be seen as a failure to meet these standards, potentially leading to citations or negative quality indicators. Finally, an approach that delegates all skincare tasks to unlicensed assistive personnel without direct registered nurse oversight and ongoing assessment is problematic. While delegation is a key nursing skill, the registered nurse retains accountability for the overall care plan and patient outcomes. Inadequate supervision or failure to ensure competency of delegated staff can lead to breaches in care standards and regulatory noncompliance, as the registered nurse is ultimately responsible for ensuring that care meets established protocols and patient needs. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough risk assessment using validated tools. This assessment should inform the development of an individualized care plan that includes regular repositioning, appropriate support surfaces, meticulous skin hygiene, and nutritional support. Continuous monitoring and reassessment are crucial, with prompt documentation of any changes and timely communication with the interdisciplinary team. Professionals must remain current with evidence-based guidelines and regulatory requirements to ensure the highest standard of patient care and to mitigate risks associated with preventable complications. Question 16. To address the challenge of accurately reflecting patient pathology and laboratory services for billing and compliance purposes within the U.S. regulatory framework, what is the most appropriate action for a critical care registered nurse to take when reviewing a patient's record? Option A. Utilize less specific ICD-10-CM codes if the documentation is extensive to expedite the coding process. Option B. Systematically review the patient's medical record, including physician orders, progress notes, and laboratory reports, to identify definitive diagnoses and laboratory tests performed, and then select the most accurate and specific ICD-10-CM and CPT codes in accordance with CMS guidelines. Option C. Assign generic ICD-10-CM codes based on the initial physician's assessment, assuming the laboratory test ordered will confirm the diagnosis. Option D. Code laboratory tests based solely on the physician's order, without verifying if the tests were actually performed and resulted. Correct answer is B. Systematically review the patient's medical record, including physician orders, progress notes, and laboratory reports, to identify definitive diagnoses and laboratory tests performed, and then select the most accurate and specific ICD-10-CM and CPT codes in accordance with CMS guidelines. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the critical care registered nurse, CCRN, to navigate the complexities of accurate pathology and laboratory coding within the strict confines of U.S. regulatory frameworks, specifically the Centers for Medicare and Medicaid Services, CMS, Guidelines and the International Classification of Diseases, 10th Revision. Clinical Modification, ICD 10-CM, for diagnosis coding. Misinterpretation or misapplication of these codes can lead to significant financial repercussions for the healthcare facility, improper reimbursement, and potential compliance violations. The CCRN must possess a thorough understanding of disease processes, laboratory test indications, and the specific coding conventions to ensure documentation accurately reflects patient care and meets regulatory requirements. Correct approach analysis. The correct approach involves the CCRN meticulously reviewing the patient's medical record, including physician orders, progress notes, and laboratory reports, to identify the definitive diagnoses and the specific laboratory tests performed. This information is then used to select the most accurate and specific ICD-10-CM codes for the diagnoses and appropriate current procedural terminology, CPT codes for the laboratory services, adhering to CMS guidelines for billing and reimbursement. This ensures that the documentation supports the medical necessity of the services rendered, aligns with payer requirements, and maintains regulatory compliance. This practice upholds ethical obligations to accurately represent patient care and financial transactions. Incorrect approaches analysis. One incorrect approach involves the CCRN relying solely on the physician's initial diagnostic impression, without verifying it against subsequent clinical findings and laboratory results. This failure to update coding based on definitive diagnoses can lead to inaccurate reporting, potentially violating CMS guidelines that require coding to reflect the highest level of specificity documented. Another incorrect approach is to use generic or less specific ICD-10-CM codes when more precise codes are available and supported by documentation. This practice can result in under-reimbursement and may be viewed as a failure to comply with the principle of coding to the highest degree of specificity, as mandated by coding standards and payer policies. A further incorrect approach is to code laboratory tests based on the order alone, without confirming that the tests were actually performed and resulted. This could lead to billing for services not rendered, a clear violation of federal healthcare fraud and abuse laws and CMS regulations. Professional reasoning. Professionals should employ a systematic approach. 1. Thoroughly review all available documentation to understand the patient's condition and the care provided. 2. Identify all diagnoses and procedures supported by the documentation. 3. Consult official coding resources, ICD-10-CM, CPT, and relevant payer guidelines, CMS, to select the most accurate and specific codes. 4. Ensure that the selected codes accurately reflect the medical necessity of the services. 5. Maintain ongoing education on coding updates and regulatory changes. 6. If in doubt, seek clarification from coding professionals or supervisors. Question 17. Risk assessment procedures indicate a critical care patient admitted with altered mental status following a suspected overdose of prescription opioids and benzodiazepines, complicated by respiratory depression and subsequent aspiration pneumonia. The medical record documents the specific opioid and benzodiazepine involved, the estimated quantity ingested, and the presence of hypoxia. Which of the following coding approaches best reflects the patient's complex presentation according to U.S. regulatory frameworks for injury and poisoning coding? Option A. Assign codes for the specific opioid and benzodiazepine overdose, the respiratory depression, and the aspiration pneumonia, ensuring each code reflects the highest level of specificity supported by the documentation. Option B. Assign codes for the opioid and benzodiazepine overdose based on the drug class rather than the specific agents, and a code for respiratory failure without specifying the cause. Option C. Assign codes for the symptoms of altered mental status and respiratory distress, but omit codes for the underlying overdose and aspiration pneumonia as they are considered complications. Option D. Assign a general code for drug overdose and a code for pneumonia without detailing the specific substances or the severity of the respiratory compromise. The correct answer is A. Assign codes for the specific opioid and benzodiazepine overdose, the respiratory depression, and the aspiration pneumonia, ensuring each code reflects the highest level of specificity supported by the documentation. Explanation. This scenario presents a professional challenge due to the critical need for accurate and specific coding of injuries and poisonings in a critical care setting. The complexity arises from the potential for multiple coexisting conditions, the severity of the patient's presentation, and the impact of accurate coding on patient care, billing, research, and public health surveillance. Precise coding is essential for reflecting the patient's true clinical status, ensuring appropriate reimbursement, and contributing to data used for quality improvement initiatives and epidemiological studies. Misinterpretation or incomplete coding can lead to significant downstream consequences. The correct approach involves a thorough review of the patient's medical record, including physician documentation, nursing notes, diagnostic test results, and operative reports, to identify all documented injuries and poisonings. This comprehensive review allows for the selection of the most specific and accurate ICD-10-CM codes that capture the etiology, manifestation, and severity of each condition. This aligns with regulatory requirements for accurate medical record documentation and coding, as mandated by bodies such as the Centers for Medicare and Medicaid Services, CMS, in the United States, which govern reimbursement and quality reporting. Adherence to official coding, guidelines, and conventions is paramount to ensure compliance and the integrity of healthcare data. An incorrect approach would be to assign codes based solely on the primary presenting complaint, without investigating contributing factors or secondary diagnoses. This fails to capture the full clinical picture and can lead to undercoding or inaccurate reporting of the patient's condition. Ethically and regulatorily, this represents a failure to accurately document and report patient care, potentially impacting reimbursement and the validity of health data. Another incorrect approach is to use less specific codes when more specific ones are available in the documentation. For instance, coding a general fall without specifying the circumstances, e.g., fall from bed, fall on same level, or the resulting injury, e.g., fracture, contusion, is a common pitfall. This violates the principle of coding to the highest level of specificity and can lead to misinterpretation of injury patterns and causes. Regulatory guidelines emphasize using the most specific code available to accurately describe the patient's condition. Finally, assigning codes for conditions not clearly documented in the medical record or making assumptions about diagnoses is a significant ethical and regulatory violation. This constitutes fraudulent coding practices and undermines the trust placed in healthcare professionals to report accurate patient information. It can lead to audits, penalties, and a loss of credibility for the healthcare facility. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough record review. Meticulously examine all available documentation. 2. Identify all diagnoses. List all documented injuries, poisonings, and related conditions. 3. Consult coding guidelines. Refer to the official ICD-10-CM coding guidelines and any relevant payer-specific policies. 4. Query physicians. If documentation is unclear or incomplete, initiate a physician query to obtain clarification. 5. Select most specific codes. Choose codes that accurately and comprehensively describe each condition. 6. Validate codes. Ensure the selected codes are supported by the medical record and adhere to all coding conventions. Question 18. Cost-benefit analysis shows that implementing a robust system for identifying and utilizing appropriate HCPCS level Roman II codes for critical care supplies and services can significantly impact revenue cycles. When faced with a complex patient requiring specialized equipment and unique disposable supplies, what is the most appropriate approach to ensure accurate billing and compliance with payer regulations? Option A. Rely on the purchasing department's general coding suggestions for supplies, as they are familiar with inventory, and use these codes for all related billing. Option B. Thoroughly review the patient's medical record and consult current HCPCS level Roman II code descriptors and payer-specific billing guidelines to identify the most accurate and specific codes for each item and service provided, ensuring medical necessity is documented. Option C. Prioritize billing for the most expensive items used, as this is likely to result in higher reimbursement and offset the costs of critical care without extensive code verification. Option D. Select the most commonly used HCPCS level Roman II code for similar supplies, assuming it will cover the majority of the items used, and proceed with billing. The correct answer is D. Select the most commonly used HCPCS level Roman II code for similar supplies, assuming it will cover the majority of the items used, and proceed with billing. Explanation. This scenario presents a professional challenge in accurately documenting and billing for critical care services, specifically concerning the use of HCPCS Level Roman II codes. The challenge lies in ensuring that the chosen codes reflect the actual services provided, are compliant with payer guidelines, and support appropriate reimbursement without leading to over- or undercoding. Careful judgment is required to navigate the nuances of these codes, which often describe supplies, durable medical equipment, and services not covered by CPT codes. The correct approach represents best professional practice because it prioritizes accurate coding based on a thorough understanding of the patient's needs and the specific HCPCS Level Roman II codes available. This ensures that all billable items and services are captured appropriately, aligning with regulatory requirements for accurate medical record documentation and billing. Adhering to payer-specific guidelines for HCPCS Level Roman II codes is crucial for compliance and to avoid claim denials or audits. This approach fosters financial integrity and supports the continued provision of necessary critical care services. An incorrect approach that relies solely on common practice without verifying current guidelines fails to meet regulatory requirements for accurate billing. This can lead to violations of the False Claims Act if it results in improper payments. Another incorrect approach that focuses only on maximizing reimbursement without regard for the services actually rendered constitutes fraudulent billing practices. This directly violates ethical principles of honesty and integrity in healthcare billing and can result in severe penalties. A third incorrect approach that neglects to document the medical necessity for items billed under HCPCS Level Roman II codes risks claim denials and potential audits, as payers require justification for these expenditures. This demonstrates a failure to adhere to payer policies and potentially to the principles of prudent resource utilization. Professionals should employ a decision-making framework that begins with a comprehensive review of the patient's medical record to identify all services, supplies, and equipment used. This should be followed by a diligent search for the most specific and appropriate HCPCS Level Roman II code that accurately describes each item or service. Cross-referencing with current payer policies and coding guidelines is essential. Finally, ensuring that all documentation supports the medical necessity and the accuracy of the chosen codes is paramount for compliant and ethical billing. Question 19. Process analysis reveals that accurate medicine coding in a critical care setting is crucial for regulatory compliance and appropriate reimbursement. A critical care registered nurse is tasked with ensuring that all administered medications are correctly coded. Which of the following actions best reflects a risk mitigation strategy for medicine coding in this environment? Option A. Cross-referencing all administered medications with physician orders, nursing notes, and diagnostic reports to ensure comprehensive documentation supports the most specific available codes according to CMS guidelines. Option B. Coding all medications administered without verifying if they are separately billable services, assuming all interventions are billable. Option C. Assigning broad medication codes to expedite the billing process, assuming most critical care medications fall into general categories. Option D. Relying solely on the Medication Administration Record (MAR) for coding, as it lists all medications given to the patient. The correct answer is A. Cross-referencing all administered medications with physician orders, nursing notes, and diagnostic reports to ensure comprehensive documentation supports the most specific available codes according to CMS guidelines. Explanation. Scenario analysis. This scenario is professionally challenging because accurate medicine coding in critical care is paramount for patient safety, appropriate resource allocation, and regulatory compliance. Errors in coding can lead to incorrect treatment decisions, inadequate reimbursement, and potential legal repercussions. The critical care environment is dynamic, with frequent changes in patient status and interventions, demanding constant vigilance and precise documentation to support accurate coding. The nurse must possess a deep understanding of both clinical practice and coding principles to navigate these complexities effectively. Correct approach analysis. The correct approach involves a thorough review of the patient's medical record, including physician orders, nursing notes, and diagnostic reports, to identify all administered medications and their corresponding dosages, routes, and frequencies. This comprehensive review ensures that all billable services are captured accurately, Adherence to established coding guidelines, such as those provided by the Centers for Medicare and Medicaid Services, CMS, for the U.S. jurisdiction, is essential. These guidelines dictate how to translate clinical documentation into standardized codes for billing and reporting purposes. By meticulously cross-referencing clinical data with coding rules, the nurse ensures that the codes assigned reflect the actual care provided, thereby upholding regulatory requirements and ethical standards of accurate representation. Incorrect approach is analysis. One incorrect approach is to rely solely on the medication administration record, MAR, without cross-referencing physician orders or progress notes. This can lead to missed interventions or incorrect coding if the MAR does not fully reflect the physician's intent or if there were verbal orders that were not subsequently documented. This failure to capture the complete clinical picture violates the principle of accurate documentation and can result in under- or overcoding, leading to compliance issues. Another incorrect approach is to use generic or broad medication codes when specific codes are available and supported by documentation. This practice, often driven by a desire for efficiency, compromises the specificity required for accurate billing and data analysis. It can lead to misrepresentation of the complexity of care provided and may violate CMS guidelines that mandate the use of the most specific code available. This can result in financial penalties and audit failures. A third incorrect approach is to assume that all medications administered are billable services without verifying their coding status. Some medications may be considered routine or part of the overall care package and may not have separate billing codes. Failing to verify this can lead to incorrect billing practices, which is a direct violation of healthcare fraud and abuse regulations. Professional reasoning. Professionals should approach medicine coding in critical care by adopting a systematic and detail-oriented process. This involves 1. Thoroughly understanding the patient's clinical condition and all interventions. 2. Meticulously reviewing all available documentation to ensure a complete picture of care. 3. Consulting official coding guidelines and resources relevant to the specific jurisdiction, e.g., CMS for the U.S. 4. Seeking clarification from physicians or coding specialists when documentation is unclear or ambiguous. 5. Regularly updating knowledge of coding changes and regulatory updates. This methodical approach ensures accuracy, compliance, and ethical practice. Question 20. Consider a scenario where a critical care registered nurse is reviewing a patient's chart and encounters the term cardiomyopathy. Which of the following best demonstrates the nurse's understanding of this term by correctly identifying its root word and its meaning? Option A. The root word is cardio, meaning heart, and the term refers to a disease of the blood vessels. Option B. The root word is cardio, meaning heart, and the term refers to a disease of the heart. Option C. The root word is pathy, meaning disease, and the term refers to a disease of the heart. Option D. The root word is myo, meaning muscle, and the term refers to a disease of the heart muscle. The correct answer is D. The root word is myo, meaning muscle, and the term refers to a disease of the heart muscle. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the critical care registered nurse to accurately interpret complex medical terminology under pressure, directly impacting patient care and safety. Misinterpreting a prefix, suffix, or root word can lead to incorrect understanding of a diagnosis, treatment, or patient condition, potentially resulting in medication errors, delayed interventions, or inappropriate care plans. The nurse's ability to deconstruct medical terms is a fundamental skill that underpins effective communication with the healthcare team and ensures patient advocacy. Correct approach analysis. The correct approach represents best professional practice because it demonstrates a systematic and accurate application of linguistic principles to medical terminology. By correctly identifying the root word, prefixes, and suffixes, the nurse gains a precise understanding of the underlying pathology or anatomical structure. This analytical process ensures that the nurse can accurately document findings, communicate with physicians and other specialists, and implement appropriate interventions based on a solid comprehension of the medical information. This aligns with professional standards of care that mandate accurate interpretation and communication of patient data, as well as the ethical obligation to provide safe and competent care. Incorrect approaches analysis. One incorrect approach involves relying solely on memorization of common medical terms without understanding their constituent parts. This is a failure of best practice because it limits the nurse's ability to interpret novel or less common terminology, increasing the risk of misinterpretation. Ethically, it falls short of the duty to maintain current knowledge and skills necessary for safe practice. Another incorrect approach is to guess the meaning based on context alone. This is a significant regulatory and ethical failure, as it introduces a high probability of error and compromises patient safety. It violates the principle of non-maleficence by potentially leading to harm. A third incorrect approach is to delegate the interpretation of the term to a less experienced colleague without verification. This is a failure in professional responsibility and supervision, potentially violating facility policies and professional nursing standards regarding delegation and accountability. Professional reasoning. Professionals should approach medical terminology by employing a systematic deconstruction method. This involves identifying the root word, which carries the core meaning, followed by analyzing prefixes at the beginning of the word and suffixes at the end of the word for their modifying roles. When encountering an unfamiliar term, the professional decision-making process should include consulting reliable medical dictionaries or terminology resources. If ambiguity persists, seeking clarification from a qualified colleague or physician is paramount. This iterative process of deconstruction, verification, and clarification ensures accuracy and promotes a culture of safety.